Under federal law, abortion providers have to tell women of the risk of death in the procedure. Imagine if you had to do that to run a marathon. Just how dangerous are abortions? Howdy folks, Trace here for DNews. Abortion is something everyone talks about, but few people really understand. I did a video a while back about how they work, so if you need to know, check that out. Recently, the U.S. Supreme Court struck down a law in Texas requiring doctors to have admitting privileges at a nearby hospital because of the purported risks to the mother. But is abortion really that dangerous? Abortion isn't just one thing. It depends on when in the gestation the pregnancy is terminated. As you probably know, human gestation is broken into 3 trimesters of about 12 to 14 weeks, and each trimester presents different risks to the woman. But overall, abortion is not risky. According to a study from Obstetrics and Gynecology comparing risk of dying from abortion versus dying from giving birth, they found childbirth is 14.7 times more dangerous. The risk of death from abortion is about 0.0007%, according to a study in the journal Contraception. This is similar to plastic surgery, dental procedures, or the number of running deaths that occur during marathons. Another study followed 54,000 women who had abortions to track any post-abortion hospital visits and found only 0.87% of women visited the ER within 6 weeks of the procedure, which is great news because half of all women in the US, or roughly 1 out of every 4 people in this country, will have this procedure. It's done so often that of 170,000 procedures studied by the Journal of the American Board of Family Medicine, only 0.85% of the procedures required reaspiration, experienced a cervical tear, or got a mild infection. None of those, by the way, require a hospital to treat. Hospitalization incidence was only 0.07%. But there are different kinds of risks for different procedures. 97% of abortions in the first trimester are done using something called vacuum aspiration. Don't picture your floor vacuum at home, it is not like that at all. Instead, picture a doctor pulling back on a syringe. Of the remaining 3%, some are done with drugs called a medical abortion. Basically, a pill tells the lining of the uterus it's time to shed, and the fetus is carried along with it. With these, the risks are also mild, mainly infections, bleeding, cramps, diarrhea, and such. But there are also surgical abortions, where dilation and evacuation takes place. These are usually done in the second trimester, and the risks are greater, but still mild. Here again, doctors are mostly concerned about infections, perforating the uterus, or uncontrolled bleeding, all of which are pretty rare. Abortions do carry a small risk for future pregnancies. A 2003 study of thousands of women found there was a slight miscarriage increase of around 2%, but overall, the risk was incredibly low. By comparison, smoking during pregnancy increases the risk of a miscarriage of that pregnancy by 11%. The major problems abortion patients should worry about is sepsis. Basically, the aspiration doesn't get all the fetal and placental tissue, which may become infected as the immune system attacks it. And if women have multiple abortions, the risk of abnormal placental movement in future pregnancies does increase. Although, remember, both of these fall under that overall low risk of hospitalization and mortality. Each year in the US, at least 700,000 women will seek an abortion. In a charged political climate like we have now, there will always be a philosophical debate, but numerous scientific studies have proven that the risk is low to the woman, as long as it is done by a medical professional. If you want to know more about how abortions work, check out this video that we did a little while ago. Medical abortions are non-invasive and use drugs like mifepristone and misoprostol to block the activity of progesterone within the human body. Without progesterone, the lining of the uterus thins until the cells are evacuated naturally, similar to a natural miscarriage. I'm sure you're already leaving a comment, but if you haven't, go down there and let me know what you think. Please subscribe so you get more DNews every single day, and thanks for tuning in.